Hi, I'm Colorado State Senator John Morse, currently the Senate Majority Leader. Thank you for taking an interest in my bills. This is House Bill 1330, the All-Payor Claims Database. This is a really important bill and actually will change the way we collect information and the way we can process information and make decisions at the state level on healthcare costs. There's an awful lot of hoopla right now about healthcare expenditures, and are we spending too much? Are the right people getting paid at the right time for the right reasons? What does it cost to treat a heart attack? There's an awful lot of those questions that really can't be answered very effectively, and certainly can't. Sometimes we have some Medicare data for people that are over 65 years of age, but we don't have the data for everybody under age 65. So this bill creates a process by which over the next several years we will create a database in which all payers put their claims, so that we'll be able to see exactly what things cost and be able to compare different providers, what different physicians do in particular cases, what different hospitals do in particular cases. This will give us an awful lot of information about cost, and the first thing to being able to control cost is to know what cost actually is. There was a situation back even in the early 70s in the Netherlands, where when the energy crisis was occurring, where a group of houses was spending 30% less energy than the rest of the houses in the neighborhood, and they couldn't really figure out what was going on until they discovered that back 20, 30 years before that, when the houses were built, the electric meter in the houses that were using less was actually in the front hallway, where people saw it on a regular basis and could see that meter spinning around, and so they turned the thermostat down, spent less money on electricity. The other houses, it was down in the basement where you couldn't see it spinning, and so they were spending all that extra money without even knowing it and just paying the utility bill every month, not knowing that there was a better feedback loop in which they could reduce their spending more quickly based on how comfortable they were and how much money they were spending seeing that utility meter spin. So that's what this bill is about, is giving us that spinning meter, if you will, to tell us what we're really spending, what it really costs, so we can then go in and start to spend more effectively on health care. So this will be a very important bill, even though it will take several years for the process to actually evolve, because we do have to figure out what data to collect, who to collect it from, how to collect it. There are some complications here, but this is a very positive first step that hopefully many other states will follow suit. So again, thank you for your interest in my bills. Think about fanning me on Facebook at Senate Majority Leader John Morse, and think about leaving a $5 contribution on your way out of the website. Thank you again for your time.